breast augmentation, liposuction, tummy tuck. These are some of the surgeries that you would have heard about in plastic surgery. These trend from time to time on social media as well. However, there are a few surgeries that create as much impact for patients who have issues that relate to the surgery, or these surgeries solve these problems for patients that are not as much talked about on social media. This video is about these non-trending surgeries that people don't really know about. Hi, I'm Dr. Saumil Shah. I'm the Director of Plastic Surgery at Skin Zone Aesthetics in Borivali, West Mumbai. And come, let's see what these surgeries are. Breast reduction. This is a very important surgery that women who have big breasts, especially post breastfeeding or post menopause, or even young women who suddenly develop large breasts disproportional to the rest of their body during their late teens or 20s, will really benefit from it. It helps decrease the neck pain, the back pain, the bra strap pain, and the repeated fungal infections that these women may face. So, breast reduction is the first surgery that I would recommend for women who have large breasts and are facing these issues. Eyelid surgeries or blepharoplasties. So, if somebody has hooding of the upper eyelid, bulges in the lower eyelids, wrinkly skin, and this is something that most people have with age. However, if it is too much, especially the hooding covering the area of your vision, or the bulges that make you look like you have never slept, then blepharoplasties are surgeries that can really help you. We can remove the bulges from the lower eyelid, which is basically excess fat, tighten the skin in the lower eyelid, remove the excess skin in the upper eyelid, and all of these without any scars being visible. So it's a surgery that you can again think about if you look tired the whole day, or if you have a drooping upper eyelid that is causing problems with vision. So again, blepharoplasties is a treatment that if you want it, you can go to a plastic surgeon, and something that you can avail of. Most Indians have a small chin. This leads to a feeling that we don't have sharp jawlines, or sometimes that someone has really big noses. A good, sharp, augmented chin is something that can bring harmony to the face, and perhaps that sharp look, the oval look in women or the square look in men, that a lot of people these days are wanting. So, chin augmentation is one such surgery that can really help you. However, most people don't know about it, and most people don't even realize that their chin is a problem. So, if that is an issue, do meet a plastic surgeon to know if it's a surgery for you. Axillary breasts are basically swellings near the armpits or the underarms where the normal breast tissue has just developed in an abnormal position. This breast tissue can increase during pregnancy and breastfeeding, and the breast tissue can sometimes become painful during menses. This axillary breast tissue also causes bulges near the underarms. So, for patients who are conscious about these bulges or who are having symptoms of pain during menses, for them it's a good idea to remove these bulges, which is basically axillary breast, during with surgery, and it helps. One last surgery that I would want to talk about is back liposuction. Now, a lot of patients who come to me, they get liposuction of the tummy and the love handles. However, you have to understand that love handles are basically fat that come from the lower back. So it's very important that we get back liposuction done as well. So when we usually do liposuction, we advise a lot of our patients to get what is called as 360 liposuction done. When you want to wear clothes, when you want to fit into some better fitting clothes, back is something that you often don't look at and is often ignored. Back liposuction is something that can really, really help. So these would be the five surgeries that I think are still underrated and patients don't know about, and it can help a lot of patients with these